Wyatt's 5 years old.
Campbell's a happy little boy.
She's feisty.
Marcus is super active.
He likes to hang out with his big brother.
From the day she was born, she showed that she has a strong personality.
He is funny and smart, but also sometimes lives in a bit of his own world.
He's a very active little guy.
Nurses would say that from the beginning, you know, when she was 1 pound, 1 ounce and fighting for her life. We realized pretty quickly that whatever picture we'd painted in our minds had to be fluid. Could change at a moment's notice.
He has brainstem dysgenesis, so it means that he can't open his mouth.
She's tube-fed. She has what's called a GJ tube because when she was younger, she could not handle food in her stomach.
He has cerebral palsy that affects all 4 quadrants of his body.
On a good day, he's got about an 11mm opening.
He's in a wheelchair. He's also deaf and blind, so that's also another challenge.
Marcus was born critically ill with a condition called hydrops. It's very rare, and not many kids survive.
It's traumatic every step of the way, watching how Olivia's been pricked and prodded and poked, you know, constantly, and you know, the gamut of tests being run and blood constantly being drawn and surgeries and procedures.
And it was the first time that we lost Wyatt.
Marcus had a bump on his leg.
And Wyatt is limp in my arms at this point. Like, there's nothing to him.
We asked for an ultrasound to be done, and it was refused. We were dismissed. In particular, I was dismissed as being a difficult mom, and maybe I was being difficult, but the flight or fight response was very clear to me. There's something wrong with my child. Just do an ultrasound. I'm telling you there's something there.
I tried to take my will and put it into Wyatt to make him breathe. And just seeing his tiny little chest and just trying to be so delicate, but it's a very fine point where you break the rib cage.
2 days later, we were seen by another new care practitioner who immediately sent for an ultrasound, and he had a blood clot from his ankle to his knee. That's not okay.
One of my triggers that I know of is being in my car.
It's seeing the pizza sign.
For me, when I get triggered, I get angry. I feel like I need to be heard.
When Campbell was in the hospital for 172 days, that was what we ate. That was the main staple we ate.
I would literally find myself at work and not have any memory of getting there. And it's because I get into the car, there's no children, there's no distractions, and my mind wanders.
It's very hard for me to cope with all this, and I was then diagnosed with PTSD. I was given medication, and we've had to increase it at times to help deal with everyday situations that are going on and coping with the loss of our son.
It kind of, having that diagnosis just put a name to something that was happening to me. It, in a way, made me feel better. I would recommend to the doctors, the medical care professionals, to just listen to us. Take the time out of their day, take 2 minutes, ask us how our day is going.
Educate yourself about the signs and symptoms of post-traumatic stress disorder. If you see a parent who is struggling, take some time to pull them aside, ask them how they're doing, and ask them about some of the symptoms of PTSD. Although your focus is the child, it's very important for you to support and assist the parent.
Part of it is communication. We find that communication is very tough. If things don't get passed on from nurse to doctor, from doctor to resident, and that gets very overwhelming.
You know, parents are the experts, so it's nice for the doctors and the healthcare professionals to listen to the parents.
I would say that one of the biggest flaws in our experience, one of the biggest flaws in the system during our experience is that, and perhaps this is societal rather than the healthcare, there's no attention paid to fathers.
It's important to view parents as part of your team. This means that you share knowledge that you have with them, but that you also respect that they have expertise.
in meeting a family for the first time, be prepared. Come knowing that they're the expert in their child. They're the decision maker in their child. And you're there to help the decision